In this video, we're going to be talking about osteoarthritis and what can be done about it that is safe, effective, and clinically proven, but at the same time, completely natural. Firstly, what is osteoarthritis? This is basically a degenerative disorder of the joints. Now, what happens here is in between the joints, we have what is known as cartilage. It's a type of really flexible connective tissue that basically works as shock absorbers and cushions between the joints. So basically, each bone sits onto another bone. And in between that, which is called the joint, we have this cartilage, which actually prevents the friction from one bone touching the other. When this cartilage gets eaten away or disintegrates, there's actually this bone on bone situation that can cause a considerable amount of degeneration to the bone itself, as well as a lot of pain and many other symptoms. But we're going to get into the symptoms in a moment. Typically, this occurs in middle age to old age. However, the youngest person that ever came to me with this was 24 years old, and she developed it due to a sports injury. Now, there are many things that can cause it. It's not just an age thing. It can affect any joint, but most common in the knees, hands, hips, and spine. In my experience, it's mostly in the knees. And this can lead to bone spurs, which are basically these sorts of overgrowth at the ends of the bones, so where the cartilage has been eaten away. And this is actually a result of the bone attempting to repair itself. Now, what are the symptoms? Joint pain, stiffness of the joints, tenderness of the joints, crackling sounds from the joints. However, just because you have crackling on its own doesn't mean you have this condition. It has to be associated with these other symptoms. Joint deformities, limping due to the pain and difficulty using those joints, especially if it's in the knees or the hips. Loss of flexibility, bone spurs, as I mentioned earlier, and swelling. Now, what causes it? Genetics is at the top of the list. If somebody in your family has had it, especially somebody you directly related to, like your mother, your father, your grandparents, then your risk of developing it is obviously going to be higher. Now, it can also be caused by overuse injuries and repetitive work. It can also be caused by sports injuries, which is what I just mentioned about the youngest case that came to me that I had. Obesity is another issue. Now, this is a big one, given the issues going on at the moment with obesity. And the reason why this happens is having to hold up a lot of weight on your knees is going to put a lot of pressure on your knees, and there's going to be a lot of wear and tear. Anytime your knees have to undergo an excessive amount of wear and tear, your body has to then rebuild whatever has been broken down. And the problem with obesity is one of the most common causes, in fact, all the most common causes of obesity, if it's not from overeating and lack of exercise and activity, if it's caused by certain conditions like polycystic ovary syndrome or hypothyroidism or fatty liver disease, all of these involve issues related to metabolism. The problem with having a weak or a slow metabolism is that it affects your ability not just to lose weight, but your ability to regenerate tissues as well. So, what happens is you are not just undergoing the breakdown of cartilage, you have to rebuild it from the nutrients that you get. And if you're not able to absorb those nutrients properly and utilize them, you're not going to be able to form the tissues that you need, such as the connective tissue. So, obesity is something, whatever the underlying cause is, you need to solve that problem. And get it taken care of, because this can lead to many other problems as well. It's really important. It's not about the way you look, it's about your health. That is the primary thing here. Next, conditions like avascular necrosis, hemophilia, and other types of arthritis can also lead to this. Now, statistically, it's more common in women, and that's also been my experience. I'd say at least 9 out of 10. Yeah, I'd say nine out of 10 are usually women. It's also an age-related degeneration. Now, as I said, it's not only age-related. Um, it can occur at any age, depending on your circumstances and what the actual cause is. But it can also be just old age. Now, what can be done about it? This is the most important part. This is what my video is about, the solutions, not the bad information. So, these are a whole bunch of things that have been used in clinical research for treating this condition that are completely natural. Now, I just want to point out the last two things on this list: glucosamine and collagen. Now, why are these two really important? Why am I pointing this out? That's because these play a role in the in the regeneration of connective tissue. And so this should actually have been at the top of the list, because connective tissue is actually made from collagen itself. So you can eat foods that are rich in collagen. You can supplement with these as well, and that can be really, really beneficial. Now, the others, such as boswellia, curcumin, and turmeric, which is basically curcumin is the substance that is found in turmeric. These have been studied for their anti-inflammatory benefits and can help you to manage the pain. Ashwagandha has also been has been studied for its ability to treat the pain of osteoarthritis. Ginger, same thing. Ginger is really, really a powerful anti-inflammatory. It also brings down the inflammatory markers in people with this condition. Now, black seed oil has been used in a clinical trial topically applied to the skin. And this can actually really, really help to get the pain under control. Now, white willow bark actually contains a substance that is pretty much the same thing as aspirin. And this has also been studied for treating multiple types of pain, including pain related to osteoarthritis. So basically, these can help you to manage the pain, get the inflammation under control, and actually be able to function each day. But when it comes to regenerating the tissue, these two are really important, glucosamine and collagen. So you can choose any of these depending on what your practitioner recommends to you. Ginger is probably going to be the safest one on this list to use on your own, but I strongly recommend that if you have this problem, go to a holistic health practitioner. That's going to be an Ayurvedic doctor, a naturopathic doctor, functional medicine doctor. And there are many other types of holistic practitioners out there, but somebody who specializes in evidence-based. It's really important to use what is evidence-based and not just traditional remedies, but things that have actually been studied and proven to be beneficial. And they'll be able to help you with this and deciding what is most beneficial in your case. Also, if you have any of the underlying factors such as obesity, you want to get that under control first. And that will actually help you to get to the point where you're able to manage your symptoms and possibly regenerate the connective tissue as well. And so, yeah, that's a few of the things I would recommend for managing this condition. Now, if you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations. So, no matter where you are in the world, you can get in touch with me and I can help you. And I'll see you in the next video.